There's a lot of places that you can work and a lot of places that you can make a difference, but you really see that here.
I got into this to help people. I wanted to be a doctor, but then I decided to change to nursing so that way I could start helping people faster.
We have consummate professionals here who are able to do things that just you'd never expect were possible. They save lives that just a few years ago would have been lost before they got here.
It's very team-centered, it's very systematic. It's kind of controlled chaos if you think about it.
In cases when we get a full unit, there can be a lot of nurses, residents, fellows, nurse practitioners down here all trying to work for that common goal of getting the patient stabilized and on to the next phase of their care. There's actually method to the madness in many ways. It can be overwhelmed. Our system, just like any system, can be overwhelmed. But I think it takes a lot more for us to get to that point than most other systems.
It's very satisfying and, like I said, in many different ways. Also, the population we take care of, like other places aren't taking care of that population. So we are a really tremendous asset to the community, not just Jacksonville, but all the way up into Georgia, West Florida. We get them all.
I got into medicine because I wanted to serve the underserved, the underprivileged, and it's definitely the patient population that we take care of here.
We've been doing this a long time. We've been the region's only level 1 trauma center for 35 years.
Standing in a five-bay trauma resuscitation unit and nothing to have 8 or 10 patients in here at a time.
As a matter of fact, here in the trauma bay, we do a very unique thing where the ED residents are at the head of the bed, the surgical residents are sort of leading the trauma, the nurses, the techs all help out with the trauma activations. It's very team-centered.
Every time we're presented with a new set of problems, we figure out a way to get past that. I have walked down here where we have patients flowing in the hallways and thought to myself, this is insane, but never that we couldn't take another patient, because that's what we're here for.
We work as a well-oiled functioning machine. The nurses, techs, the physicians, we all have such close relationships and work very hard together.
Resilient. I mean, it's an extremely resilient community of physicians, nurses, techs, ancillary staff, and one word may not do it justice, they're committed.
I love this job. I wouldn't do anything else. I wouldn't work anywhere else. I've had offers from other hospitals and I just can't see myself working anywhere else. This is where I belong. We're like a family.
It's just rewarding to be able to take care of people when they're at their most vulnerable, when they're sick or scared, and take care of them and try to make them better.